Yeah, really.
Yeah. Hey, Emma. How are you? How are you?
That age range, say that again, not the draw it for you. Again, there's because of dogs. Oh, yeah. We got a big fire.
Still not being word.
Baby's good. Yeah. One more.
Doing you got it down.
Right. When there are.
Sliding scale. And
Sure.
as far as you go, you know, when that happens, then I think it's the way I took the seat at once or, you know, to the appeal process.
Okay.
Drive. From the appeal, they come back to litigation, that's serious. Litigation, that's typically very. In most cases.
Yeah.
No, I do too. When real dollars come into play, that's when the neighborhood kind of.
You betcha. Email is free.
We'll get going in about a minute.
Something that you have to his wife.
Saw Ned last night. He was doing well.
Johnny. Yeah.
All right, so it's 12:05 and I'm gonna call the meeting to order. This is the Wednesday, February, 11th, 2026. NRPC Transportation Technical Advisory Committee meeting. Thanks for coming. Hi, everybody. And we'll do a round of introductions, starting with myself, Matt Wakens. I'm the MPO coordinator here. Most of you know me. And I'm going to read off the folks that are zooming in, and they can say hello. So, hey, Mark Chamberlain.
Hi guys, how you doing? Mark Chamberlain from Limeboro.
See that Mark's there. Didn't hear you, Mark, but I know you're there. Lisa Stedman.
Hi, Lisa Stedman from the
You're-
Monadnock region.
Hold on.
Our volume turned on.
Hold on. We're not hearing anybody. We'll get that straightened out. So bear with us just a moment. I don't. You, Lisa, why don't you say hi again?
Testing,
The volume.
can you hear me yet?
Can someone talk to see if we can hear you now?
Testing, can you guys hear us?
Here we go. Thank you.
Good. Yep,
Great. Lisa,
I'm
try
Lisa
again.
Stedman. I am the mobility manager down in the southwestern part of the state. I'm here to learn about the community rides idea that you guys have.
Great, thank you, Lisa. Let's see, Mac.
Mac Papier, grants coordinator at NHTES.
Thanks, Mac. William.
Yeah, good afternoon, everyone. William Rose at DOT.
Thank you. And Mark, we didn't hear you at first, but you want to say hi?
Hi, Mark Chamberlain from Limeboro.
Right, thank you. And we'll go over to Camille.
Afternoon, Camille Correa, the Transit Administrator for Nashua Transit System.
Victory and Town Administrator Woolman.
Paul Dana, I'm not representing Jen Beauregard, I'm coming more for knowledge.
And Greater Town of Hudson.
Benedict Cheese, City of Nashua. Jared Pretzer, Town of Merrimack.
Wayne Husband, Nashua. Mark Saunders, Nashua.
Kyle Bell, Milford. Eric Slosik, Amherst. Jacob Carr, NRPC.
Salem Quinn, NRPC.
Emma Rarick, NRPC.
In the back of the room.
Jenna Langdell, I'm here today as the chair of the Regional Coordinating Council for Community Transportation and a member of the NRPC Foundation.
Fashion NRPC.
All right, thanks, everybody, and welcome again. So, agenda item 2 is approved on January 14th. That is attachment 1 in your agenda packet, and
We have a forum, Matt.
we do have a quorum. So we're gonna need, yep. So I have Town of Amherst here, Town of Hudson, Town of Merrimack, Nashua, DPW, Engineering, Nashua, Traffic,
That's my bad.
Nashua Community Development.
Okay, we have a
Got it?
quorum.
Okay.
Quorum.
But thank you for the question. So I will entertain a motion to adopt the minutes and any discussion.
So moved.
Second.
Great. Any discussion? All right, we're gonna have to do a roll call vote on this, so we'll start with Camille. Yes or no, or abstain?
Yeah.
Yes.
Abstain.
Yes.
Abstain. Yes.
Yes. Yes.
Yes. Yes.
Yes. Great, and then Mac,
Abstain.
Mark,
Yes.
and William.
Yes.
Thank you. All right, so that the minutes are approved. Thank you very much. And we'll move on to item 3, which is going to be Camille. She's going to present information about their transit safety targets and their transit asset management targets. And I'm going to share the screen.
Good afternoon. My name is Camille. I'm with the Nashua Transit System, the transit administrator. Over the last 5 years, we have developed a transportation asset management plan, which I'll talk about in just a moment. And we've also been developing safety targets. Both of these, we need to be able to communicate to the NRPC and also to the public through NRPC. So we want to make sure that on an annual basis that we provide this information to you. And if you have any questions, please don't hesitate to ask during the presentation.
Can I ask one thing?
Yes.
Can someone from the Zoom land tell me if you can see the presentation?
Yeah, we can, Matt.
Okay, great.
So we're going to start with what is the PTAC? It's a Public Transportation Agency Safety Plan. And what the federal government has asked us to do is develop targets by which we take a look at on an annual basis and throughout the year with the safety committee to see if we need to see trends that are going up, trends that are going down, and to also mitigate any accidents, incidents, slips, falls, or transit worker assaults that may be occurring. And I'll get to what a transit worker assault is in just a moment. The safety target information changed in 2025. And when we developed the targets, we look back on 3 years of data. This is the information that was in our original safety plan and also our current safety plan. And when we look back on the 3 years of data, there's different definitions for each one of those years because the federal government had originally started with a certain definition for an injury, an accident, and major incidents and accidents, major slips and falls, anything that works within a certain category. And then when they changed that, what they did was they added the transit worker assault. So with the regulations that changed, you can see that additional ones were put in place. And then the definitions became consistent with the reporting database that we use, which is called the National Transit Database. So they went from having their own definitions to having consistent definitions throughout the federal government. The safety data that's reported to the NTD is as follows for both injuries and major events, for both demand response and fixed route. And in 2023, 2023, they started reporting for the driver assaults. At that point in time, they still had a different definition. So just in 2024, the definition became consistent. So what we've done this year is we based our performance measures off of the current definitions in the National Transit Database. They've asked us to put together our targets for 10 different categories. And these targets are actuals and we track the actuals in a spreadsheet throughout the year. Anything that's reported to the federal government, and in addition, any safety incident or accident that may not reach to the level of reporting to the federal government. So that would be if there was a fatality, it would be reported. If someone was sent away in an ambulance, it would be reported. But there might be someone that actually just slips or falls and it's not reported, but we still look at all those trends. The collision rate, the vehicular collision rate. So collision rate could also be with a building. And pedestrian collision rate, fatality rate, injury rate, transit worker fatality rate, transit worker injury rate, assaults on a transit worker, and system reliability. The assault on a transit worker can both be verbal or physical. And also on the system reliability, what that number is how many times that vehicle was not able to actually go on the road or was taken off the road during service. The target that we have here on assault on a transit worker, we also have to show the likelihood that it would occur. And for Nashua Transit, what we have is the likelihood is 3, which is moderate, and the severity is negligible. All of our assaults on a transit worker have been all verbal. So we have found from the data that we have had and looking at that in a consistent basis throughout the year, that if we find that it's a 3A. Does anyone have any questions in regards to the targets or any questions about how this is processed or how we mitigate all the information? If you're ever interested, please give me a call. Thank you. The other presentation. Matt just walked away. He'll put the second presentation up. Wonderful, thank you. The second set of targets is what we also look at on an annual basis based upon the condition of our transit assets. In addition to that, we update the plan every 2 years. And with that information, we use the federal guidelines of 49 CFR Part 625, the useful bench life for the classifications of vehicles, and also condition reporting based upon vehicles, equipment, and facilities on a 5-point scale. Starting with the targets for the 3 separate categories. There'll be 3 slides in a row. The first will be revenue vehicles, the second will be equipment, and the third will be facilities. Under revenue vehicles, the target this year will be for 10/1 of 2026. And it's based upon which one of the vehicles in our fleet has met the useful life based upon years and also on miles and also on condition. So over the years, I've calculated here what we anticipate at the end of federal fiscal year 26 that our vehicles will have met useful life benchmark. So for the transit buses, 0, so 0 are slated to be replaced. And for the paratransit vans, 7 would be either close to or right at meeting the useful life benchmark and would be eligible for replacement. In regards to equipment, we have non-revenue service vehicles. We have a Ford and a Nissan Leaf that we utilize on a daily basis for more administrative functions. And they have not met the useful life benchmark. But for trucks and rubber tires under equipment, 3 out of the 4 have met the useful life benchmark. However, some of these are very old. They're used on an inconsistent basis. They're still in a condition that we are able to use them and not have to replace them. We have an amazing maintenance staff that figures out how to fix something and work within the vendors in our community to make sure that it continues to operate. So at this time, we are not looking for replacement of any of our equipment. Under facilities, the last renovation of our transit center was in 2022. NTS has 3 separate buildings. One is a maintenance facility, one is an admin facility, and then the third is our conveyance for passengers, which is located at 30 Elm Street. So right now, all of our facilities are in excellent condition and not set for any renovation. Any questions on any of our transit asset management? It's exciting stuff, y'all. It's so much fun, especially the reporting. Thank you for your time. I appreciate it. If you ever have any questions, please let me know. Thank you.
Something I would point out that we are required to include this information in at least every 4 years in our long-range plan, our metropolitan transportation plan. And we include it more often than that. Every time we do a full update of our TIP coming this fall, we'll include the most current information from NTS in that document. So that's part of the reason we report this.
Thank you.
Yeah. Right. We're going to move on to item 4. Oh. Share. Go. So you can see that out in Zoom land, right?
Yeah.
All right. So agenda item 4. I'm going to be talking about the Community Rides program, which is operation between the NRPC Foundation, the Greater National Regional Coordinating Council, 7, and NRPC. And the plan was for me to tag team this with our regional mobility manager, Donna. She's not feeling well, she's here, so I'm going to wing it a little bit, but I think we got some. So some context, and I know some of you know about this, others don't. There is statewide coordinating council and the regional coordinating council. That sort of guides our plan, our community transportation planning. So the STC and the RCCs were created, you know, in the general report. They're part of RSA title 20, the transportation chapter 239-B. So that's the statutory authority that kind of governs and enables the SCC and the RCCs. And the reason that purpose of both of those committees is to coordinate, to develop, provide guidance for community transportation options, to ensure access to essential services. Oop, hold on, sorry. So the definition of community transportation is services meeting the transit needs of a community with a focus on special populations like seniors and individuals with disabilities. And that map is of the 8 RCCs that exist in the state. So we have, so one of the 8 RCCs is RCC 7, Greater Nashville Region. And our purpose is to engage the Greater Nashville Region in building this coordinated community transportation system. And we have a responsibility to help implement coordinated community transportation, to encourage improved transportation services, and we feedback to the statewide coordinating council. And our partners are various transportation providers, including ATS, healthcare, social service agencies, hospitals and other healthcare services, government entities, and the public. So as part of all of that system, there is a statewide mobility management network. So each of those regions has a regional mobility manager, and they work together and they collaborate with statewide mobility manager and share that, peer exchange and so forth. Again, the intention of the regional mobility managers is to really try to make sure that older adults, people with disabilities, low income people, individuals, that they can navigate and they can get access to transportation services. Yeah, and the vision is just that everybody, no matter your means, physical ability, age, you all have access to some sort of transportation. Any questions on that so far? So Donna is our regional mobility manager. And be here today, but your contact information will be in this presentation and you can reach out to us. So if she were here, she would say that mobility management is about creating community connections to transportation. And she is the definitive networker, and she is connected everywhere, all committees, and she cares most about people. And she has really established herself. People call her, she helped people get rides, and what she loves is getting people rides, but I'm just gonna say what she doesn't like is all the kind of bureaucracy around it and that kind of thing. She just is so caring about people and, you know, she gets rides for people. Talk about that. So this is a partial list of transportation options in the region, but these are the programs and providers that we kind of talk about most at the RCC. So there's the National Transit System, is fixed route and ADA service. Souhegan Valley Transportation Collaborative is a curb-to-curb, handicap accessible, on-demand service for the communities of Amherst, Brookline, Hollis, Milford, Mount Vernon, and Wilton. So individuals that live in those communities can, it's contracted with NTS. So a handicap accessible van will retrieve people that have reserved a trip. And if they're from that town, they can be transported within that town and to and from Nashville. More about that in a second. The Caregivers, which is a piece of Catholic Charities of New Hampshire, has a driver program that operates in the region. And then we're going to talk about the Community Rides program, which we've identified gaps along the way in all of these services. And that Community Ride program was created to try to help fill those gaps. So as part of Donna's procedures and she has an intake process. So the clients need to, the potential riders, she asks them their date of birth and their disability status, and that's to verify that they're eligible for 5310 funding, which is FTA funding. It's meant for seniors and those individual disabilities. We want to make sure people are eligible for that. She also checks their Medicaid status because Medicaid provides transportation as well, or funding for transportation. And the 5310 program would prefer that funding not be, if Medicaid funding is available, 5310 funding should not be used for private. So Medicaid status is important. Donna checks income because if someone can pay for services, be subsidized. And when that's the case, Donna sends them, we have the transportation directory and the wheelchair here. You can make them aware of what services are out there because they don't often know, or they don't always care. Yeah, and then she, you know, just checks availability and finds a service provider and hooks them up. So, you know, in all of this process over the years of that Donna's been doing this, and it's not really news to NTS or those of us or any of them probably, but there are gaps in the service. So they became evident and, you know, it's really bugging us. And how do we bugging us, bugging the regional coordinating council? How are we gonna fix that? So, Donna started in 2022. She's received over 1,000 calls for rides, healthcare appointments, often, and other essential places to go. And she started to realize that there were some communities that lacked access to services, especially wheelchair accessible services. So I had this idea, we need to find funding and providers to meet those gaps. So there's an opportunity arose. Donna had gone out, met with town officials, welfare officers, spoke to head of regional FTA office, talked to their staff about this lack of wheelchair service. And then she was at a local event, you know, people have tables set up to talk about their services, and there was a local bank there. And in conversation, she realized that banks have I guess, tax credits for doing stuff in their community. And she thought, well, can we get some funding to help people in wheelchairs that don't have service? So through that, there was an initial donation by St. Mary's Bank. And then that generated this process with the RCC about, how do we set this up? How do we take this funding, leverage it, create a procedure for giving people rides and so on. So that we worked at the RCC and with the NRPC Foundation and came up with a plan. And we called it the Community Ride Program. And this is the criteria for that program. You have to be a resident of one of our NRPC communities. You generally need to be over 62 years old or older, and or have a self-declared disability. And on a case-by-case basis, we'll also give rides to people that don't meet those two criteria. If people need a ride to non-emergency medical destinations, and they don't have Medicaid or some other health insurance covering transportation costs, they're eligible. And so on. And then there's that intake process that I showed you earlier that Donna goes through to establish that. And then again, priority is to non-emergency medical transportation, but case by case, grocery shopping, town hall, hairdresser, things like that. Donna goes ahead and contacts a provider and hooks that person up with their ride. And something that's good about this is that these for-profit providers who might not have been aware of these needs now are, and hopefully that provides an incentive for them to maybe be available for this type of service.
Hey, Matt, could you maybe just talk a little bit about the gaps in services that this is filling?
Yeah, so I think one of the initial things was that there was no wheelchair service in Litchfield. And that's kind of where this started. And so now there is service there. As far as, I think I talked about that.
Want to help with that?
Yeah, sure.
It really started because we had a couple of calls from our regional mobility manager had a couple of calls from Litchfield. And there's no volunteer driver program or any other public transportation that was available there. And that's kind of the start of it. And it turned out that, she was able to work something out with them prior to the community rides program. But those were the initial calls. We had 2 communities of our 13 that really didn't have any service. The other one is Lineborough. So those are kind of were the big community gaps. The other gaps that we were finding was that we had people who needed to get to Burlington, to Leahy, or they need to get to Manchester or Bedford, some of which were wheelchair dependent, some of which weren't. So again, that all is part of the complexity because National Transit, Swagan Valley Transportation Collaborative, which is a partner with National Transit, doesn't go outside of our necessary region, service region. I mean, quite honestly, a person in Merrimack can't get a ride on National Transit over to Amherst right now. So again, we have interregional issues too. But that was kind of the start of it, was those initial wheelchair calls from Litchfield.
Yeah.
Thanks, Janet.
Yeah, thank you, Janet. So here are some of the outcomes. Kind of to Janet's point, we've provided trips to Hinsdale, New London, Manchester, Salem, Derry, Burlington. And since 2024, late 2024, there have been 16 wheelchair rides. And once we started doing providing the opportunity for taxi rides, that was April of 2025. Provided 25 taxi rides. And also, as part of this program, it allows purchase of bus passes. So we've distributed bus passes to various people. Some of the outcomes. This is wheelchair organized by municipality. Yeah, thank you. There we go. So you can see it's kind of spread out. 5 rides in Hudson, 4 in Nashua, 3 in Wilton, and then 1 each in Merrimack, Hollis, Lineborough, and Brookline. And taxi rides by community. 19 in Nashua, 2 in Milford, and then 1 each in Hudson, Merrimack, Montgomery, and Wilton. And then Donna likes to put this in here again. She's a people person. This is a direct, I guess it was a transcript from a phone call that she received. Hello, Donna. This is Mr. D. I'm just calling to let you know that everything went great. Dave, the driver, was really nice and very helpful. And we really enjoyed working with him. And anytime you can come and get us, great. He had a very nice, clean vehicle. He was really polite and very friendly. We chatted all the way. It was great. I just figured I called a lot of complaints. I'm calling to tell you, good job. Work very well done. Thank you. So this program does have an impact on people. It's really important. So there are some continued challenges, scarcity of vendors overall. Right now, we only have 1 wheelchair vendor for the region that meets our qualifications. There's lack of people to help small tasks for dependent people, such as getting people to the van, because this is curb to curb service generally, right? So people have to get out to the curb, and that Donna finds that there are limitations there for these. And again, drivers can't enter homes. Some people can't even get to the door. So those are some challenges we have. Donna also wants to point out that there are fire departments in some of our local municipalities that also provide service in a really serious situation. She has a couple of examples of people that can't fit in an ambulance, can't fit in a wheelchair, can't fit in a van, literally. So she wanted to point out how even fire departments get in to try to help with this need. And then these are some of our funders. And so this is a map that shows what service is available throughout the region. And what's good about this is we now have some kind of, every community has at least some service, which is what this map is showing. And we wanted to invite you to, if you don't already attend our RCC meetings. We meet every 4th Thursday of the month at 10 o'clock right here. And anybody's welcome. And there's more information at keepinghammoving.com. And also, if anybody has other questions, you can contact Donna. So
I was just gonna make a couple of points if I could, Matt, and Janet, please jump in and correct me if I say something wrong, and I know you could supplement. But just a couple of key points is that the Community Rides Program, I think we still consider this a pilot program. It is a collaboration between the RCC, NRPC, and the NRPC Foundation. And the way we've been able to make this work is because NRPC Foundation is a 501c3, private contributions can come in through the foundation to help support it. The way we've really been able to leverage dollars, though, is RCC agreed to put in their budget, allocate, if that's the right term, Janet, a portion of the 5310 funds to be used for qualifying rides. So in that way, the 5310 funds pay for 80% of the ride. We can use the private contributions we've received to cover the 20% match. So that's been able to extend that a lot farther, which is really, really great. Another key to the program is the flexibility, because I wasn't sure if it was clear, we're contracting with private providers. So taxi services, companies like General Care Rides. So that gives us a lot more flexibility in being able to go to different locations in the region, to be able to go outside of the region. So I think it really is great. It's still a work in progress. We're still working through, I think a lot of the aspects of it, but I anticipate at least it's going to grow and hopefully we can get additional contributions to keep this program going. Anything else I missed, Janet, or said incorrectly?
No, that was actually good. I'm glad you brought up about the funding, because that was an important thing. The other thing too is the position for our regional mobility manager is really a split position. It's half funded through the Regional Coordinating Council's allocation of funding from the Hampshire DOT. And the other half is from NRPC's UPWP. So it's kind of a joint position, if you will. So again, I mention that because funding is always an issue for services and staff.
Indeed, funding is always an issue, and we're working on it. And there's definitely been growing pains especially on the reporting side, qualifying, because it's a different animal, really, in terms of funding. When we're using, DOT dollars, we're using federal dollars at 5310. So it's a little bit different than I think what some of the folks who administer the programs are used to. But we're getting there. Yeah. Does anybody have anything? Yeah.
I just also want to highlight, one thing Donna talks about in our meetings internally is how many people seeking rides to medical appointments in Boston, the hospitals down in Boston. It's a huge number.
It is indeed.
Again.
So for this program, how is outreach being handled? I just asked because, for example, in Hudson Town Hall, we have a gal who just does community welfare and assisting people when they come in with issues, and this would be the perfect type of thing for her to know about and be able to inform them of, give them information. And I'm just unsure how that outreach is being handled, or if there's something I can take to her in our town hall so she has that information.
Donna has reached out to all of the town welfare agents, at least once, and the libraries and town halls and whatever. And we do have a number of brochures. Some of them are specific for our community, and some of them are just for the region. But certainly we can take your name, or I can grab it. We should follow up on that.
Okay. Yeah, I can check in with her to make sure that she's been in contact and is aware of it.
Yeah, and Donna does a lot of outreach. She attends a lot of community meetings in the greater Nashua area. One, because she's on a lot of boards privately on her, on her real life side, but also as part of her work with NRPC and the RCC. And then through all those outreach events. I think she was over in Litchfield at the Litchfield Resource meeting. So again, it's that type of outreach, but certainly if anyone has a question, you can call her. We've got the contact information.
Yeah, Lisa, you have a question?
Yeah, I did have a question, and I can ask Donna later if you don't know the answer to this one, but how are the riders pre-qualified? Who's responsible for vetting them to make sure that they're able to take a ride?
Yeah, Donna is the regional mobility manager. She has that intake form and she asks various questions. Yeah, simple form, we can share it.
Because definitely, if there is an available alternative to them, that's where we want to point them first. So that intake is really critical. And just to Ben's point too, I think that's why presentations like this are important, because I think a lot of people are clearly not aware that this is something out there that is available.
Yeah, jump in one other second. The other piece of this too is, as Jay started to point out, when we get a call in and there may be an immediate need, but if there is an alternative, we're trying to also help people set up for the long term. So it may be somebody who hasn't filed an application with NTS for their paratransit service, or for SVTC, or for caregivers, the volunteer driver program. So we'll help facilitate that as well. So again, there's a short-term need, the immediate need we recognize, and there's that longer-term need too.
Right. And there's still gaps, I think, that we can't cover through this program. From what I understand, a lot of folks with Medicaid can't qualify for these rides, but struggle to actually get a ride through Medicaid. So that's a challenge. And as we kind of alluded to with the fire department slide, None of our providers are currently able to assist somebody, get them from inside their home to a vehicle. They have to be able to come outside and get to the vehicle. So what's known as door through door service is not something that's available. And so, that still remains a challenge.
The questions? Thanks for your attention. Next agenda item, number 5, is I'm going to direct your attention to attachment 3 in the agenda packet, which is the federal fiscal year February minor revisions. This is information only, and I did want to go through the memo with you. And I would note again, attachment 3. Halfway down, a little less than halfway down that first page, I note that minor revisions are administrative in nature, require no action by our TTAC or by the policy committee, but we always we do need to inform you about these revisions, and that's what I'm doing right now. So there are minor revision thresholds that are listed there. I don't think we need to go through all of those. But there is a link there to the DOT STIP amendment procedures where there's more information. But so the specific projects in February are Merrimack Project 29174. That's US 3 from Wire Road to Babusick Road. That's the bridge replacement over Babusick Brook and reconstruct Wire Road US 3 intersection. The change is to decrease the overall project estimate by about 1.3% within the tip years. That's an inflation adjustment. So, and there's an explanation there about how inflation can actually lower the funding in the first year of the project. So the change in the project costs within the tip years is less than 25%. Therefore, it's a minor revision. So any questions on that Merrimack project?
So was that because the project was advanced by a year? I think that was the case, right?
Yeah. William, do you have an answer for that one? I forget exactly.
I will if you give me a minute.
You can look that up.
What were they using for typical inflation though? If it's only 1.3% decrease, it seems like moving up 1 year, you probably a higher. I don't know. I thought it's like 4%. That's what DOT's been using.
Yeah, so
Probably also a good William question. That means I'm getting the answer to the last one.
well, I think maybe the answer is that. So this estimate was done in a new federal fiscal year. So what happens is it drops the previous fiscal year, and it starts over. Therefore, there's that the overall the cost within those tip years is less because that first year is now gone.
Right, but I guess to your point, it wouldn't surprise me if they increased the rate, the overall cost, so that the decrease was only 1.3 rather than 4. That'd be my guess.
Yeah, it just seems it wouldn't be only related to inflation. There's gonna be some other.
Got to be another factor.
So let's see if William.
We could probably just move on while you're getting that answer.
Yeah, so Milford Project 42470 is in the oval there in Milford. And the change is to move the construction phase from 2026 to 2027. The reason for the change is a request of the town. It is to accommodate an updated project timeline. So when you change the fiscal year of any phase of a project, that requires a minor revision. Next project is the NTS 5307 funding, and that's funding for capital planning, preventative maintenance, EDA, and operating systems for NTS. So, there's an increase in the overall project funding in the TIP years of 2.8%. Reason for this is that, yes, and NRPC kind of collaborates to notify New Hampshire DOT of any changes in the cost estimates for the various fiscal years. We get together, NPS and NRPC get together. We make those adjustments quarterly, submit them to DOT, and sometimes they generate an adjustment in the TIP. So that's what happened here for the 5307 project. We submitted the updated project estimates, and that increased the amount of funding in the TIP years, so it's a minor revision. And kind of the same can be said for the 5310 NTS program. That's FTA funding for traditional, non-traditional 5310 projects, improving mobility, seniors with disabilities, and seniors and individuals with disabilities. So the overall cost of the project between TIP years is going up just shy of 17%. That's still under the 25% threshold, so that's a minor revision. The NTS 5339 project, which is formula funds for bus and bus-related equipment and facilities, capital projects. Same thing, it's a quarterly update to their funding estimates. It's a 3.27% increase in funding within the TIP years. Therefore, a minor revision is needed. So any questions on those? There were two statewide and programmatic projects that are relevant potentially to the region. First one is program CRDR, that is culvert replacement and rehab and drainage repairs. And that the change is to shift construction funds to preliminary engineering and right-of-way phases. That shifting those funds triggers that minor revision. And the last one is environmental commitments for post-construction, various statewide locations, and funding for that programmatic is shifting between project years. That generates the need for minor revision. So any questions on any of those? All right, thank you. So that's it for February minor review. Any questions from folks on Zoom? All right, thank you. So we are on to other NRPC project updates. And I'm to talk about Jay or Cassie, any thoughts? Tyrell, any thoughts on any other projects?
Right now, no.
All right.
Do you want to mention your snowmobile counts, or is it too soon?
Well, now that you mentioned it. Yeah.
I just thought it was cool.
Yeah, so you might be familiar that I do a lot of bike and pedestrian counting in the region. We have a program where we set up our counters on sidewalks and trails and pedestrian bridges and all kinds of places. Something brand new that they're still out there actually. Something brand new is I've set up counters on a snowmobile trail in Brookline, and I've been doing that last couple of weekends, looking at that data. That's been pretty cool. It's a new territory. So I'll have more to say on that. If you're interested or curious about that, let me know. Always willing to check out new sites for those counters.
Thanks, Tyrell. Yeah. All right. Item 7, municipal updates. Anybody, any of our communities have anything they want to talk about?
just a brief update. We have a fare change or proposed fare change process that we're going through right now for outreach. We have a public hearing on February 25th at 7:00 PM at the City of Nashua Committee on Infrastructure. And that's for anyone who's interested in providing public comment for the fare, the proposed fare increase and the fare amounts. We are sending the information out to the community. We are gathering comments and feedback. We're following the Title VI program for that, and the LAP or limited English proficiency, and wanting to make sure that the information gets out to the different communities. This only affects the city bus, the ADA paratransit, and the senior service for the Nashua Transit System service in Nashua.
Anybody else?
Wilton's bidding out, one of its bridges, Kingbrook Road Bridge, on Friday. We're gonna be posting it. I think it's gonna be back in March. We're gonna get the results. If anybody knows, any bridge contractors that are filling up their schedules, please put them in touch with us. And we could have some more news, I guess, if things go well with permitting and everything like that for a couple of our other bridge projects coming up.
All right. How about state updates? How about Mac?
As of right now, we still have a couple 100,000 left for Granite State Clean Fleets. So Granite State Clean Fleets is open, and that can fund a couple of great projects as well. So I would encourage people to apply for that, of course. I think when we talked last, I believe we might have released that we opened $1 million for New Hampshire Clean Diesel. And so we've opened that to public and private entities, including nonprofits, which is something that was different than last time. And we've also opened it to not only off-road, but on-road and engines and basically idling reduction projects. So we've expanded that a little bit more as well, which is great. I believe we talked about our RFI, which is currently closed. So we're in the process of going through that information, and we're hoping to see what we can do with that funding moving forward here. That's all for now.
Thanks, Mac. William.
Not a lot of news to share. The 10-year plan continues to work its way through the legislative process, and I think that's it for big news.
All right, thanks, William. All right. Anything else? Anybody wants to talk about? So if anybody has any ideas for future presenters or themes for TTAC meetings, go ahead and think about that and reach out to me. And we can keep it interesting for everybody and informative. Always looking for ideas. So please don't hesitate to reach out. All right, motion to adjourn.
So moved.
And second by Kabir. And all in favor, say aye.
Aye.
Anybody not in favor? All right, thanks, everyone. Well.
Thank you.
So
Foundation project. Somebody did.
yeah.
They have